for your validation, for that last validation, you're really just going to have to do sort of a general assessment and then do all of the lymph nodes. And you are going to have to do them, and you're going to have to say what they are as you do them. And I'll address that. You're going to palpate the trachea, look at the conjunctiva, and then inspect the mouth. And that's really it. But I'm going to go over a little bit more thorough exam. So, you know, we always start out with, so Maurice, hi, I'm Kathy. I'm your nurse today. I'm going to be doing a little inspection of your head, face, neck, and then I'm going to look at your eyes and ears and up your nose and into your mouth. I'm going to start by just kind of looking. You know, we always start with inspection. So let me just kind of look at your head, if you don't mind, and I am going to touch you. And I'm looking to see if, remember, we always check for symmetry. We're always checking for symmetry to make sure that both sides look right. And we want to look and see if his head looks like it kind of fits on his body, like it's about the right size. And it does, right? We don't want it really, really big or really, okay. And then we're going to touch a little bit. We're going to do a little palpating. Maurice, I'm just going to kind of touch your skull. And we're looking at the hair. Now, this is your opportunity to start asking your avatar some questions. So tell me, do you have any trouble with your scalp?
I don't.
Do you have dandruff?
I don't.
Do you have seborrhea?
I don't.
Do you have any acne breakouts in the skin on your head?
Don't.
Okay, do you have any areas where your hair falls out?
No.
Or seems to be thin?
No.
Okay, everything looks pretty good here. Do you have any tenderness where I'm touching?
No.
Okay, do you have any tenderness behind your ears here?
No.
All right. How about along the base of your skull here?
No.
Have you ever had any head injuries?
No.
Have you had any surgery on your head?
No. No.
Okay, so it looks like I don't see any scars or anything. Everything looks good. Okay.
I did have a head injury, actually.
Did you?
Yeah.
When was that?
I don't know, like, I'd say 20 years ago.
So what kind of a head injury was it? Can you describe it to me?
It was a skateboarding accident.
Did you, were you unconscious?
No.
Okay, so you did not lose consciousness?
I did not.
So were you diagnosed with a concussion?
Yes.
And what did you do for that? How did you follow up for that?
I don't remember.
Okay. Have you had any, okay, and then did you have any more symptoms after you recovered from the concussion?
No.
So these would be the kind of follow-up. Did you have to go to the hospital?
I did.
Okay. Did you have to stay in the hospital?
I did not.
Okay. So you were treated and released,
Yes.
and you've had no ill effects that you know of from your concussion?
Correct.
Okay, I'm glad to hear that. Okay, well, your head looks symmetrical. I don't see any injuries or any obvious signs of illness. I'm going to come here to your temporal area. We call this your temporal area, and see if I can feel your pulses, which should be right kind of in front of, so you want to feel for the temporal artery. And I'm going to have you open and close your jaw a little bit for me while I keep my fingers here. Okay, open and close. Yeah, open and close, open wide, ah, yeah, open and close, ah. Okay, this is called your temporal mandibular joint. Do you have any pain here?
No.
When you open and close? Does it feel stronger on one side than on the other?
No.
It feels equal? Do you ever hear any clicking noises?
No.
When you open and close? Okay, so what are we looking for? We're looking for like the TMJ to see that it's operating. And also at this point you might want to ask, can you frown? Okay, can you smile? Can you puff your cheeks out? Okay, just kind of doing our little facial, yes, our little facial,
Nerves.
okay, I don't want to get, okay, and we're looking for symmetry, which is to rule out what? Bell's palsy, right? I want to assess a little bit for Bell's palsy. Okay, so,
Facial paralysis.
yes, so that would be one-sided facial paralysis. So now we want to look at, and I'm going to confess to needing a little cheat sheet for this. All right, so I'm going to be palpating for your lymph nodes to see if any of them are swollen. Do you think you might have any swollen lymph nodes today?
No.
Do you have allergies?
No.
Do you have any seasonal allergies?
No.
Do you smoke?
No.
Do you live with anybody who smokes in the house?
No.
Okay, so maybe there's no reason why you should have swollen glands. Did you ever have mononucleosis?
Mm-mm.
All right. So we're going to start with our, okay, pre and post auricular. The reason these can be kind of difficult is because they're not really swollen, and so you shouldn't really be able to feel them, right? So it's hard to find them. When you're doing your validation, you're just going to be saying, I am palpating the pre-auricular, and it should be kind of right in front of this little tragus here. And then the post-auricular should be right behind. And then the occipital is right down here, as one would think, right along here at the base of the occiput. Okay, tonsillars are right here at the jawline, right here at the jawline. And they can often be a little bit swollen, especially depending on the season. Submandibular is right in front, and then submental is really right under here. And they should all be, you either shouldn't be able to feel them or you shouldn't be able to feel them much, or they should be pretty soft and movable. Now, your anterior and posterior cervical, anterior comes down kind of right along these sternocleidomastoid muscles, and posterior right behind. And again, you should just not be feeling much of anything, you know? Sometimes you can feel a little bit. And then the supraclavicular, you come to this little notch right here and move your fingers just to the side, and those are right along here. Now, if you've ever seen anybody with mononucleosis, they can have these look like a golf ball right up here, but you should not really be seeing these. How am I doing here? Okay. And then at this point, you would probably want to ask, I'm going to ask you to move your head from side to side. You feel like you can move your head well? Can you put a little pressure on my hand here? Okay, a little pressure on this hand. Okay, very good. Can you turn and look over this shoulder? All right. I'm also looking for jugular venous distension. Does anybody know what I'm talking about? That disease, the jugular veins? Right.
Is it on the right side?
Well, you have two
Both.
jugular veins, so
Right. So, okay.
you have two jugular veins, so they should not be visible when the patient is sitting up like this, and it should be no more than just slightly visible with somebody whose head is elevated at about 30 degrees. So I'm going to be looking for that, and I'm also going to be coming around here. I'm going to come behind you now, and I'm going to check your carotid arteries, and they are easily palpable, equal, regular, and you can listen for bruits if you want with the, you're going to use the bell of your stethoscope. Okay, I'm going to be listening here. Just a nice, even pulse. You know, what is a bruit? Do you guys know what a bruit is? It's a whooshing. It would be whooshing, and that would indicate turbulence. And we do not want turbulence because it indicates what? Obstruction, gunk built up. So your neck pulses are really nice and even, and I don't hear any turbulence or anything abnormal. Can you swallow for me? Okay, do you have any problems swallowing?
No.
Do you ever choke on your food or have trouble swallowing food?
No.
Okay, now if somebody said yes, what would you be asking?
Solid or solid?
Is it more, yes, when did it start? How long have you had it? Is it more on one side than another? And then you'll probably get some kind of history of either like throat surgery or a stroke or something like that. Okay, I'm gonna feel for your trachea. The trachea is this windpipe that goes right down your neck here. And I know people sometimes feel like they're choking a little bit, so I'm gonna try not to put a lot of pressure, and I'm just gonna make sure that it is supple and even and that I can feel it and that it moves just a little bit from side to side. And it's doing exactly what it's supposed to be doing. Is that okay? Any pain or anything with
No.
that? Okay. I already looked for jugular venous distension. let me see, trachea, oh, okay. And the normal thyroid should not be palpable. But you need to ask your patient a question, probably, like, do you ever get your thyroid level checked?
I have, actually.
Okay, great, great. So do you have like an annual exam?
Mm-hmm.
Okay, all right. So, all right, so that was kind of that. Now, okay, I am also going to look at your conjunctiva. Do you know what conjunctiva are? Okay, that is the area around that. It's kind of what we call the pinks of your eyes. So I'm going to have you look up for me a little bit. And I'm just going to pull gently down. If you could look up, please. Okay. And his are nice and moist and pink and not, you know, overly red or overly pale. What if they were really, really pale? What would you be asking?
Anemia.
Discharge.
If they're really pale, you might be anemia. Maybe about anemia, about have you had your blood checked recently? Seems very, very pale. What if they were really, really red? What if his eyes were really red, really
Irritant.
okay? Like, do you go back to, do you smoke? Do you have allergies? Do you work around chemicals? I mean, it's just kind of like the same sort of deal. And we're also looking for, now I already did kind of a little facial nerve thing. You see how much overlap there is? I already did a little facial nerve thing, but I'm also looking for ptosis. Remember we talked about that, about drooping eyelids, about whether his eyes are symmetrical. We would do Perla if we were doing an EENT, a full exam. We did that last week. We would do Perla. Blah, 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 blah. We check the facial nerve, visual acuity confrontation, a visual acuity test. We would be doing all those things, and then we'd be looking at his eyes with an ophthalmoscope, right? Which I demonstrated last week. So I'll have you move over here and look at your ears in just a minute. But let me do, okay. So I neglected to do our cranial nerve 11, right? I would have had him shrug his shoulders. I'm gonna put my hands and put a little pressure here, and I want you to shrug even though I'm trying to prevent you. Okay, very good. So that's a nice strong shrugging. Also, can you stick your tongue out? Okay, and wiggle your tongue back and forth. Okay, very good. Now I'm gonna put this tongue depressor in your mouth, and I'm gonna have you say ah. And now, what are we looking for? Remember what we were looking for last week?
Evenness of voice.
Even
Not,
Symmetry.
We're looking for symmetry. We're looking to
Sound.
see that the palate goes up and down on both sides. We're looking to see that the uvula is midline. What we're also going to do is I'm going to have him keep his mouth open. I'm going to look at his teeth, lips, and gums a little bit. And this is why we need our gloves, okay? And I would probably want a light source. So if I could have you look up. All right, can you say ah? Okay, great. All right, and I'm looking around, looking all around. Don't want to choke him. Okay, everything looks great. You have seriously nice teeth. Okay.
10 years worth of braces.
Yeah, wow. And you don't have like a whole, see, I'm at the age where I've got all that metal in my mouth, you know? And you've got all, whatchamacallit, ceramic, whatever it is. Okay, so I'm gonna be looking here. Okay, teeth good. Now, what would we be looking for here?
Like there, would you be looking at the gum
Discharge
pulse,
of
all
the
the gums?
You want to be looking for decay. You want to be looking for gingivitis, like a lot of redness, irritation, any kind of oozing, any signs of decay, any signs of kind of, you know, missing teeth, bad dental work. You want to be looking for any kind of abnormalities like whitish, plaquey looking things, discoloration, lesions, and anything like that. You want to start asking a bunch of questions. You want to go right to old cart. I see you have some white spots on the inside of your mouth. And then the patient answers you. And then you go into, you know, when did you get those?
What if they didn't know about them?
Well, if they didn't know about them, then
You do that.
and you say, well, we're going to need to follow up on this, right? Okay, and then what I'm going to do is kind of put, and some examiners will even take a 4x4 and grab the tongue, lift it up, and look back and forth. Can you put your tongue behind? Very good. Okay, everything looks really good here. Okay, so the last thing we're going to do is I'm going to take, how are we doing? We're doing pretty good, aren't we? Is I'm going to look in your sinuses. Yeah. I'm We're gonna look in your sinuses.